The year is 1955, 5th of November to be more exact, and the French painter Maurice Utrillo just passed away. Now, you might say, if I would have pronounced it Utrillo or maybe Utrillo, you might have recognized him, but Utrillo is the right way to pronounce it since it is a Spanish name. So Maurice Utrillo just passed away, and what does it have to do with the subject of today? And by the way, the subject of today's presentation is alcohol dependence. Well, if you look into his paintings, you will see that mostly they depict just cityscapes of Paris, more specifically Montmartre, where he was born and where he spent most of the time. And you will see in there the depiction of restaurants, at least one in each painting, or a outlet for the sale of alcohol. You are not going to look for something that looks like United States, like in the United States, but you will see the business sign outside saying vin. Vin is spelled V-I-N-S and means wine or wines for sale. So Utrillo is a typical French painter. If there is any cliche about French painters, I am sure that Utrillo can kind of hits every mark of it. He was born to Suzanne Valadon, a model. Of course, model has another meaning. It had another meaning then than it has now. This woman was to be a model for the painters, impressionistic painters of that time. And who was the father? It's kind of unknown. It may have been Degas or Renoir, or maybe it was the father who actually signed the birth certificate, and this was Miguel Utrillo, and also a painter he was a Spanish painter, but living in Paris, but of lesser importance than Renoir and Degas. By the way, there was a common joke circulating about Utrillo. When he was born, Suzanne Valadon went with baby Maurice first to Degas and told him, "This is your baby." Degas took a look and he said, No, it cannot be my baby. It doesn't have the right color." He went to he went to Renoir, and Renoir says, No, it cannot be my baby. It's not the right shape. Finally, he went to Miguel Utrillo, who said, "Oh, I will always put my signature on any Degas or Renoir." So he signed the certificate. But anyway, it was, of course, just a joke. Utrillo, mentally ill. For his first admission in psychiatric unit was at 21 years of age, and many of them followed. At that time, he attacked his mother, and he ended up in the so-called insane asylum. Addicted to alcohol all his life. He had numerous admissions in what people called at that time rehabs in France, but to no avail. He practically drank until his death. Now, is Utrillo typical for an alcohol-dependent person? It is and it isn't. It is not, through the fact that he created something of value, something that people appreciate. By the way, his paintings sell nowadays very seldom under $500,000, and is not characteristic because he died at 71. Usually alcohol kills you much sooner than that. But otherwise, it's a typical story in the sense that he started in his late teenage years. He became addicted to alcohol since his early 20s, and practically he never got cured of this alcohol dependence. But let's go to work and see a little bit about the main topic of today's presentation, alcohol. What is this alcohol? Well, alcohol has a remarkably simple molecule. It's what we refer to alcohol, chemically it's called ethanol, and it's a very small molecule composed of two atoms of carbon, a hydroxy group, that means this group containing one oxygen, one hydrogen atom, and then another 5 hydrogen atoms kind of sprinkled around the molecule. So it's surprisingly simple for the vast effects that it has on the body. But let's start with the beginning. Let's say that you took that glass of wine. What is going to happen next? 20% of it is going to be absorbed through the stomach. 80% of the alcohol that you just ingested is going to be absorbed through the small intestine, the beginning of the small intestine. By the way, it happens to be also the place where the vitamin B or the vitamins from the B complex are absorbed. And since it's the same area, alcohol can impair the absorption of vitamin B with a lot of consequences down the road. So once it's in your system, that means it goes into the bloodstream, and through the bloodstream it goes all through the body, including the brain, and we will speak in more detail what it does to the brain. And ultimately it has to be detoxed from the body. 5% of it is eliminated by the lungs, and 5% is eliminated by the kidney in its original form. But the bulk of it, 90%, is eliminated by the liver. In two steps mostly. First, there is an alcohol dehydrogenase that destroys the molecule of alcohol and downgrades it to acetaldehyde, which is a component that is not very good for the body. It has a lot of toxic effects, and we will see what those are. And then another step where an acetaldehyde dehydrogenase deteriorates the compound again to acetic acid. Acetic acid or vinegar, it's of course a component much less problematic for the body and much easier to get rid of. So what are the effects between the moment when it is absorbed and until the moment when it's kicked out of the body? What is happening with it? So let's start with what is happening on the brain. Now on the brain, it acts on an area called the ventral tegmental area nucleus accumbens. So this is the pleasure center of the brain. This center has an evolutionary purpose. It will encourage the individual to do things that are good for the person and the species, like eating, procreating, and getting positive regards from other human beings and so on. But anyway, it acts on that center. To be very specific, this alcohol, it takes the brakes off the ventral tegmental area. What does it mean? The ventral tegmental area is a group of neurons that sends its impulses to the nucleus accumbens. The ventral tegmental area is in the midbrain. That means this area between the cortex and the brainstem. And the nucleus accumbens is somewhere in the orbitofrontal lobe, on the medial aspect of the orbitofrontal lobe. But the location is less important. Just remember that there is this reward system of the brain that is composed of this dual structure, ventral tegmental area on one side and the nucleus accumbens on the other. Now, this ventral tegmental area is also innervated by some neurons that are powered by a neuromediator called GABA, gamma-aminobutyric acid. These neurons are the brakes of the VTA. The alcohol inhibits the brakes. That means the alcohol will have a negative impact on the GABA neurons, which inhibit the ventral tegmental area. So when you drink alcohol, you take the brakes of the ventral tegmental area. Therefore, the ventral tegmental area starts lighting up with electricity, and it triggers a enjoyable, pleasurable response. So that's the essence. That's where the dependence has its origin. And every addictive substance somehow ends up stimulating this pair of nuclei, the ventral tegmental area and nucleus accumbens. So let's see. What is the acute effect of the alcohol? Well, it depends very much on the levels, on the blood levels. But to get to the blood levels, let's see some ways to quantify the intake of alcohol. Well, the standard unit of alcohol intake is the drink, so-called a drink, the mythical drink. A drink is either one beer of 12 ounces 12 ounces, which contains 10 to 14 grams of alcohol, or a glass of wine, 4 ounces of wine, which contains the same amount of alcohol like the 12-ounce beer, and also one shot of liquor, the shot being 1 to 1.5 ounces. And of course, the content is the same, 10 to 14 grams of alcohol. So the drink is the unit of administration of alcohol. And when I say a drink, it can be anything. It can be either 12 ounces of beer, 4 ounces of wine, or 1 ounce of liquor. When you drink 1 ounce of liquor or one drink, let's say, your blood alcohol level goes up by 0.02. Now, when I say 0.02, I mean 0.02 grams per 1 deciliter. Or in other places, you will see expressed as milligrams per deciliter or milligrams per 100 cc. And in that case, when I say 0.02 grams per deciliter, I also mean 20 milligrams per 100 cc of blood. So that's the concentration of the alcohol. So I will use only this gram per deciliter expression just to keep things simple. So you took a drink and your blood level goes up to 0.02. Between 0.02 and 0.03, there is this kind of pleasant effect of alcohol, the euphoria, but also you start already seeing the psychomotor retardation that alcohol typically causes. And what does it mean? You slow down. You slow down with the speed of thinking. You slow down with your speech, and you slow down with the reaction time. Above that is an important level, 0.08. 0.08 is considered in the United States the legal definition of intoxication of alcohol. Now, this does not mean that you are okay drinking with 0.08 concentration of alcohol in your blood, because this depends on the state. Some states have 0 level of alcohol as a limit. Others have 0.08. You have to be cautious about that. Now, let's say that you are drinking and drinking and drinking. Your blood level starts going up and up. Between 0.1 and 0.2, what you will see is increasing affection or increasing effect on the frontal lobe. And what does that mean? Your abstract thinking is impaired, the limbic system is now disinhibited. And what does that mean? Your emotions are more intense and are more easy to trigger. You get easier angry, you get easier excessively happy, and you start laughing without reason. And you are increasingly impaired in your ability to speak. Your speech is slurred, and of course everything is kind of slowing down. Between 0.2 and 0.3, the impairment in alertness is very pronounced, and you may even fall asleep. Above 0.3, the inhibition of the brain starts going into the mid-cortex or into the midbrain and into the brainstem, and this is where the trouble starts. There, in this area of midbrain and the brainstem, there are the centers who regulate the automatic activity like breathing, and if those areas of the brain are inhibited, then you are going to stop breathing. You're going to fall into a coma, and eventually, if you are very unlucky, you are going to stop breathing and die. So alcohol is a dangerous substance. In fact, the lethal dose is only 10 to 11 times higher than the intoxicating dose. What does that mean? If you need 2 to 3 beers to feel intoxicated, then 11 to 14 beers taken all at once can actually put you into a coma and maybe even cause you to stop breathing. Now, what will happen in long term? This is the acute effect. In long term, you will see first a tolerance developing. What does that mean? You are going to be more resistant to the effects of alcohol. You are going to metabolize the alcohol a little faster, but especially the brain becomes more resistant to the euphoric effects, the pleasant effects of the alcohol, and also to the negative inhibiting effects of the alcohol. That means you're not going to fall asleep so easily under the influence of alcohol. You're also going to develop a tolerance to these levels where coma usually starts. And you are going to need increasingly bigger amounts of alcohol to feel that you had enough overall. Aside from that, you will develop withdrawal. What does it mean? If you drink repeatedly and then you stop abruptly, you are going to develop a set of symptoms that we call withdrawal. And what are those symptoms? Sweating, shakiness, tremors, the blood pressure or pulse go up. You become very irritable or anxious. Sleep is going to be very difficult or impossible. And if you are unlucky, you will get into a state called delirium or withdrawal delirium or delirium tremens. You're going to start hallucinating and you're going to start talking completely nonsense. And this is a severe medical emergency that must be treated in a medical setting. Another manifestation of withdrawal, equally dangerous, is seizures, withdrawal seizures. They can happen anytime between 12 hours to 3 days after the interruption of the alcohol. Are extremely dangerous, not in themselves, but because they result in falls, complete loss of consciousness, maybe aspiration if you throw up while you have a seizure. So it's another serious manifestation of the chronic consequences of alcohol intake. What are the psychiatric or psychological consequences of alcohol? Of course, we have to start with alcohol dependence. What does that mean, alcohol dependence? Well, alcohol addiction or alcoholism, these are terms that are so vague that I am not quite sure how to define them, but I know very well what does the DSM-4, that means the Diagnostic Statistical Manual, 4th edition, says about the alcohol dependence. In order to meet the criteria for alcohol dependence, first you have to understand that you are not tied by any quantities. The presence of dependence is not defined by the quantity of alcohol that you are drinking. Is defined in as follows. You take a 12-month period where you want to judge whether the symptoms are present or not. And now you ask yourself, within these 12 months, are there 3 or more out of a list of 7 criteria met? The first 2 are easy to understand. One is tolerance, that means needing increasingly higher amounts of alcohol to get the same result, the same intoxication or the same effect. Withdrawal is the syndrome that starts once you abruptly discontinue the alcohol use. Now, there is a cluster of symptoms that I call time shift. Time shift, what does it mean? It means that you spend increasingly amount of time in activities related to getting the alcohol, being intoxicated with the alcohol, or withdrawing from the alcohol. And another aspect is shifting the time from activities related to alcohol and getting into or crowding out activities that you would have normally done, like work or relating to your family or other social activities or just leisurely activities. They are just kind of crowded out by the involvement with the alcohol. Then there is a sub-syndrome of loss of control that contains 3 manifestations. One of them is taking the alcohol in quantities higher than initially intended or for longer amount of time than initially intended. So you see this pattern of increasing the use of alcohol over time. Then you have a tendency to be unable to stop. That means you take the decision to stop, but it never happens. You have repeated failed attempts to stop taking alcohol. And finally, the last symptom is this tendency to be aware, to be fully aware of the consequences, the negative consequences of alcohol, but still not being able to stop the use of alcohol. So any 3 out of this set of 7, clustering within the 12 months period would constitute a diagnosis of alcohol dependence. In the definition of the DSM-4, the official listing of all the diagnoses in psychiatry. I am going to speak now about this phenomenon of relapse. It's connected with the issue of dependence. Now, relapse means a resumption of the intake of alcohol in the context of a period of time when there was no intake of alcohol. So after a certain period of abstinence, then you have this phenomenon of increased cravings and eventually relapse. The cravings are in fact a anticipatory stimulation, but very light stimulation of the system ventral tegmental area nucleus accumbens, which anticipates the bigger reward of actually drinking. This phenomenon of craving, this minor stimulation of the VTA nucleus accumbens system, is caused either by cues, just situations that resemble to situations in which alcohol intake might happen, or is caused by stress. And here there is a relationship with the corticotropin releasing factor, the CRF. It's pretty much the initiator of a cascade of events that constitute the response to stress of the organism. So cues is one, stress is another one, and finally is the phenomenon of priming. What does it mean, priming? Priming means the stimulation, but again a very modest, a very discrete stimulation of the ventral tegmental area nucleus accumbens system by any substance. It is very well known that using any other addictive substance like marijuana or even cigarettes or opioids will trigger a craving for alcohol, and very often will trigger a relapse of the alcohol. We talked about dependence and somewhat about intoxication, but let's see what else does the alcohol do to the brain. The DSM-4 lists all the problems that all the issues that can happen when you drink alcohol, and I can tell you that alcohol has a longer list than any other addictive substance. And what could that be? First, besides alcohol abuse, alcohol dependence, you can have an alcohol withdrawal plus an alcohol withdrawal delirium, which is another entity, and we spoke about delirium tremens. Then you have an alcohol intoxication delirium, and that means the same cluster of symptoms happening while you are highly intoxicated with alcohol. Then there is another syndrome called alcohol-induced persistent dementia, which is the same like senile dementia. That means an impairment in memory, but also in psychomotor skills. Then you have alcohol-induced persisting amnestic syndrome, when just the memory is impaired and nothing else. It used to be called Wernicke-Korsakoff syndrome. And it was mostly caused by the deficiency of vitamin B, and mostly reversible by administering vitamin B. But for many months, it's not something that is going to go away in the short term. Then you have a alcohol-induced psychotic disorder, which again looks like schizophrenia, which I guess is the prototypical psychotic disorder, alcohol-induced anxiety disorder, alcohol-induced mood disorder, alcohol-induced sexual disorder, and alcohol-induced sleep disorder. So you see, it's kind of a long list of problems that can go wrong. All of them have in common the fact that they are, although they resemble as the real deal, as a real symptom, they are in fact temporary disturbances that should clear within a few weeks. Let's say the standard is 4 weeks. They should pretty much clear, and they do not need in most of the cases at least medication to make them go away, or a persistent treatment to go away. What does it do to the rest of the body? We saw what does it do to the brain, but now it's poisonous for the rest of the body, and it can affect the body up to the moment when you ingest it, and all the way down into the gastrointestinal tract. It can increase the cancers of anywhere between the mouth, the esophagus, the stomach, the intestines. It can increase the risk of breast cancer, of course, in women. It affects in a very negative way the pancreas. Alcohol-induced pancreatitis acute pancreatitis is a very common problem. And finally, the liver. Now, the liver has different stages of being affected by alcohol. In the beginning, it's just a hepatitis or a steatosis of the liver. That means infiltration of the liver with fatty tissue, which kind of choke the cells of the liver and impairs their activity. And that can progress even further into a cirrhosis. That means a scar tissue replacing the normal cells of the liver. And this is usually a process that is irreversible. It ends up in the need of liver transplant and death if that does not happen. Now, what is the magnitude of this phenomenon? Well, this alcohol issue is one of the biggest plagues of the century. It's something that is responsible for the majority of the substance-related deaths in the United States. It causes enormous economic loss in the United States economy because it affects a lot of people, and it's legal. It's legal to be consumed by anybody above 21 years of age. But let's see, who are those people? First of all, 90% of the US population is exposed to the alcohol. So only 10% can say that they go through life without ever drinking alcohol. But out of this vast number of 90%, only 20% develop what we call alcohol abuse. Now, alcohol abuse is an entity that is different than alcohol dependence. It's like the premonitory sign of much worse things to come. Alcohol dependence is everything that is problematic in terms of consumption, does lead to repercussions in people's lives, but does not meet the criteria for full-blown alcohol dependence. So alcohol abuse has a prevalence of 20% in the population, and then the alcohol dependence itself is 6%. So you see, 90% use alcohol at a certain point in their lives. Only 6% actually become dependent. Let's see who these people are. Who are the people at risk? Who is eventually trapped into this alcohol dependence? Well, if there are definitely genetic factors and cultural factors involved, and also personal factors, but let's see first the genetic factors. Alcohol is regarded as an issue of willpower by many. It's something that you should choose not to do. But the truth is that the evidence for a genetic component for alcohol dependence is pretty strong. For example, if you have one parent who is suffering, who is diagnosed with alcohol dependence, your chances of becoming dependent at a certain point in your life are 4 times higher than average population. And even more interesting, let's say that you are taken away from that environment. We take away this situation where you might say, well, it must be the example that the parents are setting for their children. No, if you take a child of an alcoholic out of that family and put it at birth in another family with no alcohol problems, his or her risk is still going to be 4%. See, that's quite a convincing argument that alcohol dependence has a strong genetic component, a strong genetic vulnerability that is going to be there no matter what the environment is. Of course, the environment can make it worse or can make it a little better, but overall, not much influence on this vulnerability. Another evidence is the fact that if you have an identical twin brother who suffers already of alcohol, your chances of getting the same problem is much higher than if you would have an identical a fraternal twin. If we go even further and ask ourselves what is in the genes that can determine if one has a vulnerability or not, well, some genes encode the enzyme, that means dictate how an enzyme, acetaldehyde dehydrogenase, is going to function, what type of enzyme a certain individual will possess. It turns out that there are two types, one of them, two types of genes, one type that gives you a strong acetaldehyde dehydrogenase that will metabolize fast the acetaldehyde into acetic acid, and another type of gene that will encode a weaker enzyme that will be a little sluggish in metabolizing the acetaldehyde. Now, let's see what are the repercussions. Well, the people who have a good enzyme, that means they will get rid of this acetaldehyde, which I mentioned before is a one step down from alcohol, and it's a very toxic substance for the body with unpleasant effects. If you get rid of it, you are not going to have the negative effects of having acetaldehyde in your system. But if you have the less effective acetaldehyde in your system, then you are going to be exposed to higher dosages of acetaldehyde every time when you drink. Therefore, you are not going to be so anxious, so eager to drink, because drinking will just make you sick. Therefore, you will see a certain protective effect if you are of that genotype, and this genotype is characteristic for the Asian population mostly. Now, there are some associations between mental illness and alcohol. If you are predisposed, or you have a genetic vulnerability to develop either bipolar illness or schizophrenia or antisocial personality disorder, because all of these are partially genetically determined, then you are going to have also a vulnerability to develop alcohol dependence. So these seem to be connected. The risk of these three illnesses come hand in hand with the risk of alcohol. Of particular problem is this association between antisocial personality disorder and alcoholism. But a subtype of antisocial personality with a lot of impulsivity seems to be at the highest risk for alcohol dependence. There is something also interesting about this association between how the body metabolizes the alcohol and your likelihood of developing the illness called alcohol dependence. There have been very good studies made showing that resistance to alcohol will predict very accurately your future dependence on alcohol. That means if you seem to have a little reaction to alcohol, that means alcohol does not touch you that much when you are an adolescent and you try it, well, guess what? You are more at risk to become dependent on alcohol. The mechanism, the exact mechanism is not quite sure. Maybe if you are resistant to alcohol, you are going to underestimate its power and you are going to drink more than usual. So before you're going to get completely sick and tired of this whole presentation, let me get to the treatment. So finally, we are going to speak about what can be done. We talked about all these things about what can go wrong when you drink, but now what can you do to escape this problematic path in life? Now, the treatment, I would divide it into immediate and chronic. That means what can be done once you are already stuck into dependence up to the neck and you want to get out of it, and then what can you do to make sure that you do not fall back into the same mistake. Now, in the acute phase of the treatment, what you need is probably a detox. The detox, it's very often really not a big deal. That means for someone who is young, who is healthy, who is well nourished, doesn't have any coexisting medical problems, that should not be an issue. It's going to peak within 2 to 3 days, and after that it will last for another week or so, and then it's completely gone. But in those people who are coming off massive amounts of alcohol, or those people who are medically frail or who are elderly, then you may need a medical detox. And what does it mean, medical detox? You are going to go into an inpatient unit where you are going to be given a benzodiazepine, usually either chlorodiazepoxide or Librium or diazepam, the brand name Valium, or even just Ativan, lorazepam. It's much less used because it's a shorter acting benzodiazepine. So mostly we like to use the long-acting benzodiazepines. Let's say that you start with 30-45 milligrams of Librium in the first day, and then you go down by 20% every day. The whole detox should last anywhere between 5 to 7 days, and you are going to go over this period in a much kind of smoother way. Of course, people are very concerned when it comes to alcohol withdrawal because of the withdrawal delirium or delirium tremens, or this risk of seizures that can happen pretty much to anybody anytime. There is nothing that can reassure a physician that you are going to be okay during the withdrawal. Age doesn't count, predisposition doesn't count. There are some issues that can make a physician even more worried about withdrawal seizures, for example, a pre-existing seizure disorder. Now, it's not necessarily that you use benzodiazepines. Nowadays, you can use also anti-seizure medication like Neurontin or Depakote, or even no anti-seizure medication, but a alpha-adrenolytic substance like clonidine, or even a beta blocker like Inderal. Now, what they do protect you from the negative effects of the withdrawal on the heart. It tones down the heart, it decreases the blood pressure, but it will not protect you from a seizure disorder. So these adrenolytic substances will not prevent the seizure from happening. But let's say that detox is not an issue. You want to go straight to the chronic treatment. Now, there are several options, and I list them in order of the demand that is imposed on the individual, but also in the order of success. Although the difference in success, meaning achieving abstinence between these four formats that I'm going to list, is not that prominent. So number one is Alcoholics Anonymous. This is a self-help group that you go there only when you want to, when you choose to. Nobody keeps track of that. It's a personal effort. You can practically decide how much time you want to invest into this activity. Then there is the Outpatient Substance Abuse Program, which is a more regimented program, more structured, and of course run by professionals, so-called people who have a certification in drug and alcohol counseling. Then you have the 28-day inpatient rehab. If the situation is so bad that you couldn't resist taking alcohol unless you are completely disconnected from your usual environment, you go into an inpatient 28-day program. And finally, there is the treatment community. Treatment community is a place where you live for 6 months, for 12 months, and you try to completely disconnect yourself from a previous lifestyle that brought this predicament in the first place. When you are going to enter these programs, you are going to do it in a voluntary manner. Most of the people go in a voluntary manner. There is also evidence that being forced by the legal system into these programs can have pretty similar success rates. But this whole process may start with the need of an intervention. Now, many of you are familiar with this notion of intervention, and what does that mean? It means a meeting with all interested parties. That means family, friends, where the person, the patient who suffers of this problem, is forced to see the reality of the addiction. Now, when I am saying forced, it does not mean necessarily confrontation, but it's just a moment when the cards are pretty much laid on the table, and the imperative of treatment is put in front of the patient. You have to understand one thing, that a patient will move into treatment only when there is enough incentive, when there is the energy and the motivation to do it. And an attitude of the people around the patient called codependence may prevent that point to be reached. Codependence means this tendency of the relatives or friends of a patient to protect that person from the negative effects of the alcohol, therefore prolonging that point where the patient will have the incentive to move towards treatment. Treatment in general has two components. One of them in clarifying, that means an educational component, clarifying the effects of the alcohol on the body in physical terms and the psychological terms, but also in social terms, the effects, the repercussions of using alcohol in people's lives. And another component which is concerned with relapse prevention. That means all this set of measures that a person must take in order to prevent falling into the same mistake again and again. So now let's look at the medication treatment of the alcohol. Nowadays there are three main medications that are recommended in situations like this, and I'm going to start with the oldest, but I'm not going to spend too much time on it. This is the Antabuse. The Antabuse of or disulfiram is a blocker of the enzyme acetaldehyde dehydrogenase, and what it means is that once the alcohol is metabolized into acetaldehyde, you are going to be stuck with it in the system. Stuck with it in the system means that you are going to have a terrible headache and feel some flushing and nausea, and it's kind of an aversive therapy. If you drink, you are going to be very sick. Now, in principle, that should be a very interesting proposition, a very interesting strategy, but the fact is that people who want to drink, they just plainly stop the Antabuse in a day. They are ready to take alcohol without this effect. So in practice, it turns out that it's not that effective as a method. The other one is naltrexone. Naltrexone or Revia. This is a dopamine blocker, and it's an opioid blocker. And what does that mean? It blocks the enjoyable effects of the alcohol. It blocks the capacity of the alcohol to stimulate the system, ventral tegmental area nucleus accumbens, therefore diminishing the pleasure that one gets out of alcohol. The evidence that naltrexone helps in decreasing the alcohol intake is pretty strong, but is not very big. It's pretty strong in the sense that it's clinically significant. It is there, but I would say that it increases your chances of staying absent by a rather modest 15 to 20%. Then we have the medication called acamprosate or Campral. This one is a blocker of the NMDA receptors, which are found on the nucleus accumbens. It's a little bit kind of another mechanism of preventing the ventral tegmental area nucleus accumbens reacting to the presence of alcohol. Again, the same like naltrexone, decreasing the enjoyable effects of the alcohol. This, I hope it serves as a primer to have some tools to deal with the alcohol in case it's a problem that affects you or anybody else that you know.